We're back with Snoop Dogg. Snoop Dogg in Tokyo. This is Simon Dogg in Tokyo. Okay, let's get on with this question. We're going to talk about diverticulosis. We have one question here. A 65-year-old man comes to the ER because of blood in his stools for the last few days. He denies fever, chills, nausea, or vomiting, and also says that his bleeding is painless. His last colonoscopy was 5 years ago and only showed several colonic diverticula, but no colonic polyps or cancer. His temperature is 37, pulse 80, respirations 15, and blood pressure 120/80. Rectal examination does not show any abnormalities. Leukocyte count is 5,000. Barium swallow is performed and is shown below. You cannot see it because I'm on osmosis.org, but just try and imagine it. What do you think this is? Which is the most likely diagnosis? Is this A, colonic diverticulitis, B, colonic diverticulosis, C, colonic polyps, D, Crohn's disease, or E, ulcerative colitis? So remember the question stem. This 65-year-old man says he has blood in his stools for the last few days, but he denies fevers, chills, nausea, or vomiting, and also says that his bleeding is painless. So the answer here is colonic diverticulosis, not diverticulitis. This is an outpouching of the colonic mucosa and submucosa that arises from an unclear etiology. Patients are often asymptomatic. However, a small fraction of patients with diverticulosis develop symptoms. Bleeding alone can sometimes be the only sign of diverticulosis. So what if you thought it was colonic diverticulitis? Why was that wrong? Colonic diverticulitis can arise from the patient's history of diverticulosis. However, this diagnosis is unlikely because he is afebrile, does not have abdominal pain, and has a normal leukocyte count, which was 5,000. Also, diverticulitis is not associated with lower GI bleeding. What if you thought it was Crohn's disease? Remember that Crohn's disease is associated with multiple areas of ulceration and inflammation on barium study. Distension of small bowel with contrast material is required for proper evaluation of Crohn's disease with barium swallow. What if you thought it was ulcerative colitis? Remember that UC is associated with a lead pipe colon and a loss of haustral markings on barium study. Mucosal inflammation leads to a granular appearance on the surface of the bowel. Don't get those confused. What if you thought it was the polyp? Colonic polyps may be a tempting initial choice, but the patient does not have a history of polyps, and on barium swallow polyps would be represented by areas absent of barium. Excuse me, I'm getting a cold here. Listen to some more Snoop Dogg. Okay, what else can we say about this? Remember, colonic diverticulosis is an outpouching of the colonic mucosa and submucosa that arises from an unclear etiology. This condition is common in older patients and more common in the sigmoid colon. Interestingly, there is more right-sided diverticulosis in Asian populations. Patients are often asymptomatic. However, a small fraction of patients with diverticulosis develop symptoms. Common symptoms include abdominal pain, bloating, altered bowel habits, or flatulence. Bleeding alone can sometimes be the only sign of diverticulosis. Diverticulosis is often found incidentally during a routine colonoscopy, but can be found throughout various imaging modalities, including abdominal X-rays, CT, barium enema, and colonoscopy. Plain abdominal X-ray may show signs of bowel wall thickening, barium enema, and show outpouching of the colonic wall, but it is important to rule out colonic diverticulitis before performing a barium swallow or a colonoscopy, because of the chances of barium leakage or colonic perforation is increased with diverticulitis. Thanks for tuning in with our talk of diverticulitis, diverticulosis with Snoop Dogg. This is Simon in Tokyo.